Welcome to the Explore Global Health podcast. I'm Dr. Rob Murphy, Executive Director of the Havey Institute for Global Health here at Northwestern University Feinberg School of Medicine. An important part of doing global health work is what happens after you return home. Publishing research, sharing stories about the experience and the people you meet is essential to expanding knowledge, capacity, and equity in global health. Today's guests are expert in the art of gathering global health news. And today, they're going to share very practical advice on how to work with journalists to bring your research and global health insights to a wider audience. Brian Simpson is the editor-in-chief, and Dayna Kerecman Myers is the managing editor of Global Health Now, a daily newsletter based out of the Johns Hopkins Bloomberg School of Public Health. And this newsletter is definitely a must-read publication for anyone interested in the United States and global public health. Welcome to the show, Dayna and Brian. Brian, tell me about Global Health Now. I understand you recently published your 2000th newsletter. How did this end up being 2000 newsletters? Tell us.
Well, it's definitely been a journey. Back in 2013, we saw the need for kind of a one-stop shop for information about global health. As you know, there's so many different fields, so many different disciplines, so many different issues within global health. To have it in one place is a challenge, right? To get all of your news kind of in one place, not only with the news in your particular field, but with other fields. We talked with some folks and some experts, and I had initially had this like very grandiose idea about a National Geographic level magazine about global health, and we got the advice to do a newsletter, do an email. It's a kind of quick, easy touch on a large number of people, and you can kind of build an audience and kind of go from there. And so that's the genesis of Global Health Now, and we started on January 2nd, 2014.
So can you tell us a little bit about the reach of the newsletter?
We reach 58,000 subscribers in 170 countries. So we've got a great reach. I think it shows that hopefully that it's a reliable and useful daily newsletter. It comes out Monday through Friday.
Hey, Dayna, a question for you. Can you walk us through the editorial process? How do you decide what makes it into the daily emails, and where do the stories actually come from?
Sure. We tried to cast a wide net. So we set up a lot of Google alerts for about 40 topics pertinent to global health and public health. We monitored those daily. And we also have a set of news sources and journal articles, journals, blogs, people who tend to write about global health issues. And we go through those sources every day too. So we do some in advance, and then early in the morning, we go through all of those again and pull together what we think is most important, most interesting. We try to have a mix of things from different countries and different topics, and we collect sources based on that. And then we go through and we see what is most important for that day.
So you're based at Bloomberg School of Public Health at Hopkins. So is it pretty heavy Hopkins oriented, or is it more general? How does it work with the school?
That's something that I really love about our work. We always set out with the mission to reach out to other schools. We talk to faculty and students at other schools. We check for other schools' newsletters. We go through those in compiling our news also. We try to advance the common cause of global health that way. So it isn't just about what we're doing at our school, but really trying to find where there are connections and interesting opportunities.
The big part of the secret sauce for Global Health Now is that we're finding like the best news, the best research, the latest research and news to share. And it doesn't matter where it's from. We're just kind of try to decide on, basically on the value of it.
We also hear from a lot of readers. We have people who are involved in studies who send us notes and let us know that something's coming. So over the 8 years we've been doing this, we've developed a nice network of people who share information and know about GHN and help us out that way too. And that also makes sure that we aren't too focused on one topic or perspective.
Can you tell us a little bit about who are your readers?
A lot of readers are faculty from various schools, students, public health practitioners, and researchers. And we also have lots of people who represent NGOs or global institutes focused on health issues, the WHO, We also have everyday people who don't work in global health at all, but these topics cover so many different issues. It touches everybody in some way.
Can you tell me a little bit about the stories that are the most popular?
That's an evolving process. And we do very much look to see what people are interested in. We hear from people. We hear from people who don't want us to cover topics, but mostly we hear from people who care about a topic passionately and wish we covered it more. We've done surveys where we've asked people, what do you want more of? And when we do that, we mostly hear that people want to hear more about other countries, not just about COVID. We hear that a lot lately. It's changed a lot in the last 2 years in that sense.
Yeah, we've had the same thing. We do a question and answer for COVID, that was just so big. And I think we're going to continue with that, but there's so many other things going on.
Yeah, it's interesting to watch how an issue becomes big. Also, I remember before the pandemic with Ebola, for example, it started off that we felt like, are we covering this too much? And then it quickly became apparent, no, this needs to be the top story every day. This is getting big. But it's interesting to see how that shakes out too.
Can you tell me a little bit about your own background?
I started out working in different media outlets, working for foundations that are doing media development and strengthening the media overseas. Then I worked for the NewsHour with Jim Lara, where I was responsible for monitoring wires and pulling the early idea of stories, the early round of stories that would be shaped, things would change, and we would use that to put together the news summary at the top of the show. And then I did a lot of freelance science writing, work on different projects. And then I worked for the Stanford University School of Medicine, the Stanford Blood Center, working on different communications projects. So that was really where I learned about the different platforms, different channels, and putting together a product.
I, like Dayna, have a mixed background. I started off in journalism as a police reporter in Northwest Florida, and I returned to Austin, where I worked in the tech industry for a while and did editing and writing there, and didn't find it super satisfying and was always kind of like freelance writing along the way. And when I moved to Baltimore, I started freelancing for the School of Public Health here, for the magazine here. And in 1999, I was on a trip in Asia with my wife. I was covering a communications campaign in Uttar Pradesh in India, seeing this unfold and how it worked, and they were using traditional theater to get a message across. It was kind of like life-changing for me to be there and to see, kind of public health actually happening on the ground. And so I totally fell in love with public health. And after that was able to get on here at the School of Public Health at Hopkins and just, got my MPH and just became totally enamored with public health and the public health mission.
I'd like to hear from each of you about one particular story that you featured that really kind of sticks out, a memorable piece for each of you personally. Can you think of one and how it got there and what happened?
The story that always stands out for me the most, and it's probably because it was our first Untold Global Health Stories contest, and I love the origin of this story. Mycetoma, the neglected disease in Sudan, we had a contest we did this with the Consortium of Universities for Global Health and NPR's Goats and Soda, although that came later. We started off, it was just something that we did with CUGH. That first year, a student from Canada submitted the idea, and it was the way that they submitted the piece. And this really speaks to if people want to get their issue or their story covered more, the way that you present it, if there's a story with it, it makes it so much more attention grabbing. But it was very moving. They said that they had prepared briefs. They'd worked very hard on this disease to get the WHO to add it to the list of neglected diseases. And they prepared the briefing, and it was at the World Health Assembly. They had the classroom or the room laid out with all of their briefing packets on the table, and no one came. And so to think about a neglected disease, that was really the most neglected disease that could have been in the mix that year. And so we ended up picking that. And then through that contest, it's a contest where you don't really win a lot yourself, but you get coverage for your issue. So it's to highlight an underreported topic. So as a result of that, we had the journalist Amy Maxman go to Sudan and do a series of articles for us. And that ended up helping to bring more attention to the issue at a very critical time. And it did end up making it on the list. So that one always stands out for me as something very, very meaningful.
Brian, what about you?
I'm going to pick sort of another Untold Stories series that we did on burns in Nepal. And, it's something that you just don't think about that much. But in Nepal, people oftentimes will be cooking inside on the fire, inside the house. They have perhaps more than 50,000 serious burn injuries every year. We actually sent a reporter, Joanne Silberner, to Nepal to cover this story and did a 3-part series that got into sort of the human costs as well as sort of some of the solutions as well too. That one sticks out to me because there's so many issues out there that do not get attention that really need to. And there's so much great work going on as well. For us to be able to surface some of these issues and some of the solutions is one of the things that we're most proud of.
If somebody has an idea, has a story, can you just submit the story? Can you tell what the process is like there?
Absolutely. We welcome ideas. A lot of times we'll say that we run on ideas where they're essential to us. And especially with something like global health, there's so much going on and so many things have been covered that new ideas are most welcome. And usually we'll try to work to figure one out, how to use it one way or another. It may not be a big splash, but we oftentimes will work with our readers to get attention to some of these issues.
Can you give maybe some readers some tips about an element of a good story if they want to submit to you?
So if you have an idea based on something that you're interested in, or if you're a researcher or an expert wanting to write a commentary, it's a little bit different. But we're always looking for stories that haven't gotten enough coverage, or that the mainstream media hasn't been interested in, or that there's some angle that isn't being picked up or that the media is missing. So we love it when people send us an idea and say, well, this is an important issue, but consider this element, or we've been working on this, and it helps to surface a different perspective. We want people to send us stories that aren't just promotional about their work, though, not promotional about their organization or an issue, but really just, is there something that needs to change? Is there something interesting that's happening, something innovative? Those kind of stories are most interesting to our audience, I think.
How important is social media?
We definitely do keep an eye on that, and we look for people who are experts to follow, to give us ideas about things, to see what people are talking about. So definitely social media is important for giving us more ideas. It's also important in how we can use it in the newsletter to share other people's perspectives. We try to include tweets partly to add a little visual break between the blocks of text in our summaries, and also as a way to include a little bit more opinion pieces.
We became an institute just 3 years ago, and we have now 10 centers and programs, and it's really getting pretty diverse group from neurology to surgery, education, cancer, cardiovascular, everything. It's really quite broad. Can you advise our Institute members what they can do to prepare themselves for interviews with the media, or how to basically interact with the media, including your media? Maybe some advice for them. A lot of them have never done anything like this before.
The first thing to do is to recognize that you have to change your mode of thinking and interacting. When you're talking with the media or reaching out to the media, you're not reaching out to a colleague, a fellow expert in global health or whatever discipline. And to do that, you need to do some translation as well. So you can't sort of use the insider speak that you do with your peers, but to distill things down to the essence so that any smart layperson can understand it. And part of that is thinking about, like, beforehand, what do you want to get across here? Like, what's the most important thing? So distilling that message, because oftentimes scientists are so excited about their work and they have so many ideas and so many details to get across. But what you want to do is find out that the essence of the story, and you want to formulate it and put it together in a way that a journalist can, kind of like grab onto and say, okay, now this is interesting. Oftentimes journalists, reflexively turn to their news judgment. And so what they want to know is, are a lot of people affected by this? So some kind of sense of scale. They want to know what's new, right? There's in the news, it's always got to be new. You don't want to rehash certain things. You can formulate things as well in terms of a problem solution. So problem, number of people affected by this particular disease or condition, and then move right on to, why your research is important and how it can make a difference. And, does it play a role in the solution? People always want to know what's happening next. Where are things going to head from this? So problem, solution, future, I think those are, kind of big tips there to guide people. Dayna, do you have other thoughts?
Yeah, I think people might write a study. If they're a scientist, it might be a very long title, for example, and they feel frustrated when they see it in the media and it's been clipped. But we're trying to package things in a way that will draw in different people. So it's a challenge always. When people help us with that translation part, we can do a better job when they tell us what matters the most about their study.
One other thing that helps is having a story that goes along with it. Data are one thing that can motivate people, motivate interest, but having a story, a human story that goes along with it can be extremely powerful. And so we're talking about people who may be affected by this issue. And so researchers often, know these people and work closely with them, just regular people who are dealing with these issues. And to hear kind of what they go through, to hear personal stories, I can't tell you how important that is, because that's like a huge motivator. For a journalist or other media person covering an issue, sticking just purely with the numbers is kind of one thing, and sometimes that's super important. Oftentimes it's super important. But when they can, they want to bring in real people and how real people are affected. And so thinking along those lines as well can be another thing that can help.
What do you think about op-ed pieces? Scientists and researchers writing op-ed pieces. Never saw it before, but now I see it actually quite a bit. What's your take on that?
I think it can be interesting to see a commentary that goes along with a study. It's a place where you can see additional insights. If there's some big thing that might need to change as a result, or mapping out what should happen next, what helps place it in context, I think it can be a good thing. I think we just have to be really careful to make sure that we're clear. So in GHN, we separate things, we try to label them commentary, and it is hard to separate those sometimes when they're in scientific journals or if it's a letter, that kind of thing. As long as it's clearly labeled, it's good to have scientists getting involved in communicating these ideas to the public more and more of their direct voice.
We had some issues recently with kind of evaluating COVID vaccines, and that this kind of over focusing on antibody responses and not the cellular immune responses is kind of missing the whole boat, seeing how we can't even prevent the infection now at all, basically. And it's we're just keeping people out of the hospital with these vaccines. And I don't know where that really goes. Is that a kind of an op-ed type piece that you guys would consider, or have you done anything on that?
I would say absolutely. I think that's a great example of how scientists can have a larger impact, that they can shift public attitudes, perceptions, policymakers and what they're doing. Whenever I hear, hey, we're missing the boat on this issue, that, definitely captures my attention. I think in the past, scientists were much more reluctant to kind of weigh in on these issues and usually would, kind of work amongst their peers and sometimes, reaching out to policymakers to share ideas and things like that. And certainly with COVID and probably before COVID as well, scientists have done a much better job of reaching the public and using their knowledge, but also their powers of persuasion to make a point and to shift the public discussion and shift what's happening in terms of policy and federal support, local support. When it's all evidence-based, having the scientists weigh in directly, there's a huge advantage to that.
When somebody sends in a piece to you like that, is it kind of a yes-no thing, or do you actually say you like the topic, but, it's like way too wonky or something? Do you actually give them some advice, or do you just say, go get some training in how to write an op-ed?
Oftentimes we absolutely will work with our readers who are now writing for us, with scientists who want to get the word out. And we try to find what would work best for an idea. So just this last week, we got an email from a researcher who brought out a new study and wanted to, get some attention to it. And so it looked very promising. And so we said, hey, we can do a couple things here. You could write a commentary on this because there's a clear call to action, like something needs to change. So that's kind of one thing that we're always looking for in a commentary, or a straight up kind of summary that we normally do in our newsletter. Or those don't sound interesting. We also propose that we could do like kind of a mini Q&A that would discover why is this important and what needs to change because of it. So we try to tailor the response and the publication to what would work best, we think. So absolutely, we'd love to hear from people and hear ideas.
Another thing that people don't do often, they'll send us a commentary idea if it's in the news or they just finished their study. But I would love to hear from more people who follow up then a year later and say, this is what happened. It might not be something that's going to make headlines or get picked up by the media, but just that ongoing conversation. Did anything change after your study suggested these additional research areas? Or did students see that and then take on those topics? So that's another idea, to have more follow-up and more ongoing conversations. I also just wanted to say that there are practical tips too. If a scientist or a researcher or anybody, someone working for an NGO, they want to send an idea, it's always nice to reach out to us just with a brief idea first, because we often get 1,000-word or more commentaries that are very dense and not really in the right tone for what we do, and they have to be edited to get it to fit a much shorter space. So it's always better to reach out first and talk it through before you just send the finished piece.
We also have many publications, commentary guidelines that explain what we're looking for, the format, what works best, what doesn't work. I think when you're a scientist and you're reaching out to any publication, to know kind of what they're looking for, get their guidelines in advance is always a great idea.
Can you share some examples of actually what not to do? I mean, there must be some things that just automatically get rejected. Any little tips there?
The biggest one is just not being promotional, not promoting your organization or your school. We're more interested in seeing what is the issue, how does this affect other people, what's meaningful and what are the takeaways, than just trumpeting the accomplishments of another organization or school. A very small thing that's specific to us, we want to share a diverse group of voices we have a Global Health Voices tweet section, and some people, there are experts in the global health field that are just so good at this. And so they often will take someone else's retweet and then pull out a really interesting detail from the study. And it's really hard not to share that tweet, but we want it to be from the original person who wrote the study or did the story. We want to do more of that. We try to have that diversity of voices, but we also want the tweet to be visually interesting. So a lot of people will just tweet a study that has just text and then it doesn't make the cut because it just doesn't help the visual side of the newsletter at all. So the ideal tweet is from the person who either wrote the article or did the study, from their account, and they pulled out something about it that really grabbed them, some reason why it really stood out to them, and there's a photo of the article. So that's just like a very technical thing for us, that's the best way to get a tweet shared.
Research results, as you both have alluded to, and I know quite well, oftentimes are a little dense. It can be difficult to promote, to get this into the public outside of your niche group of people that know exactly what you're talking about and no one else really understands what you're saying. Depending on the topic, what recommendations can you give to sort of package the message so that it can actually have an impact in the media?
Yeah, that's always a huge challenge. And I think first you have to be kind of realistic about the message. And as we all know, how iterative science is, and it builds on very small advances. And you have to kind of keep that in mind and be realistic in terms of what will an editor and a writer, a reporter respond to. There's a few things you can do with that. And we talked about, the power of story and people who are affected by an issue. One of the key things I think is are you breaking new ground? Is this a different kind of breakthrough? Is this something that people will be curious about and want to know more about? Will it be surprising to them? Possibly, too, another thing to think about is, do you have your own personal story? Like, why are you researching this particular issue? What have you seen? Can you bring that into the mix? Do you have a body of work that is going to change the science, that's heading in a new direction? Is there controversy there? Are you battling kind of established dogma? So you want to give people more than just the data bits, but to give them more of a compelling story as well as the data. I think that's what I would say. Dayna, what do you think?
I think having quotes, too, from the researchers, having something that's interesting, some hook that just makes it stand out a little bit, that's always really helpful, too. It's also helpful if you bring in, this is specific to global health, but if you bring in other people that helped with the research along the way, if instead of submitting a commentary by the lead author only who's based at a Western school, it's really nice to see when they bring in more details. If there is a partner institution overseas that they worked with, that's always really nice for us to be able to highlight too. And we try to pull that information out. And honestly, if people are submitting a commentary to us, it helps to have those different voices. We want to hear from other people and we want to engage more people overseas. So doing a joint commentary, it's sometimes hard because we're English only so far at this point, but bringing in another author can help too.
That's really great advice. So I think that pretty much wraps up our discussion for today. I want to thank you both, Brian Simpson, Editor-in-Chief, Dayna Kerecman Myers, Managing Editor of Global Health Now, a highly successful newsletter that goes out every weekday to over 58,000 readers in 170 different countries. Congratulations on the fabulous work. And I'm sure after this podcast, you're going to probably pick up quite a few more readers, I think, because you're doing such a fantastic job. Thank you both so much for taking the time to talk to me today.
Thank you so much.
Rob, thank you so much for your time. This has been a real pleasure.
Follow us on Apple Podcasts or wherever you listen to podcasts to hear the latest episodes and join our community that is dedicated to making a lasting positive impact on global health.